Good afternoon and good evening, everyone. I'm Amelia Munsterman. I will be the facilitator for this webinar. On behalf of the Continuing Education Committee, we welcome you and thank you for being part of this ACVS webinar offering, 5 Critical Concepts to Transform Your Idea into Publication, sponsored by Wiley. We will have a great mix of attendees, so we look forward to a robust Q&A session. Before we begin, let's go over a few housekeeping items. Please note that the attendees will be muted for the entirety of this webinar. However, you will certainly have an opportunity and are encouraged to ask questions. Please note that a continuing education credit and maintenance of certification activity points are not available for this webinar. We ask that you submit your questions through the Q&A function, not the chat function. You may use the chat function to share comments with each other. However, we will not be monitoring the chat function for incoming questions to presenters. And please note, both the chat and the Q&A functions are intended for webinar-related questions and content only. And finally, today's presenter, Dr. Dominique Griffon, will present her webinar, followed by a brief Q&A session afterwards, as well as a few in between. Type your questions as you think of them, and we will answer as many as we can. Remember, use the Q&A function to submit the questions. Let's get started. I'm happy to introduce Dr. Dominique Griffon from the Western University College of Veterinary Medicine, presenting 5 critical concepts to transform your idea into publication.
Thank you, Amelia, and good afternoon and good evening to all colleagues. I hope you are sitting comfortably. We're going to be spending the next couple of hours together and going over 5 concepts to transform your idea into a publication. Before we get started, I have to disclose a potential conflict of interest. I am currently the editor-in-chief for Veterinary Surgery. I also serve as associate editor for Biomed Central Vet Research. And so obviously a lot of the presentation that I'm going to do is going to be focusing on veterinary surgery and related research, specifically clinical research. Because we're spending 2 hours together online, and I understand how draining this may sound, I'm going to try and make this session as interactive and entertaining as possible for you. And just to get you in the spirit of things, I'd like you to start with this question. It's what we call an ice-breaking question. If you could join the poll on your phone, you should be able to access the question, and you should now be able to enter your answer. So you should read the question on the screen. Which of the following best describe you? Are you a veterinary student, a post-DVM trainee, so that includes graduate students, interns, residents, a veterinarian, a specialist in practice, or a specialist in sectors other than practice? Okay, I have 100% post-DVM trainee. I'm just going to give you a few more seconds to get used to the format. We will be using this format throughout the presentations just to make sure you understand the concepts that are presented and just keep you awake. All right. No veterinary students, no one from academia or research institution. Okay, so technically this is showing me your responses. Okay, very good. So I will try and emphasize the aspects that are especially relevant to the post-DVM trainee, and perhaps move on a little faster on those that are not as relevant. All right, so let me explain you first what editors want, because ultimately this is your goal, is to get your idea into a publication. So you need to understand the perspective from editors. They want to address their audience needs. So for us, it's going to be surgeons, whether they are in private practice or in the research setting, but we're looking at papers that have impact and relevance for our audience. So that dictates the scope of the journal. Again, we're looking for impact through a scientifically sound methodology and high readability. And the editors are also supposed to maintain some metrics per the journal, and we'll go over those a little bit later in the presentation, but that sort of explains why they are very interested in articles that are likely to be published, because that makes the review process more efficient and easier for everyone. And they are interested in articles that are likely to be cited, because this is how the impact factor of the journal can increase. So as a potential author, how can you best address these? So we're first going to talk about creating a viable project. And actually through this presentation, I'm going to walk you through all the steps from generating your idea all the way to writing your paper. So obviously this is not equivalent to a week workshop, but at least it's going to present you with some broad concept and general principles that hopefully will help you. So creating a viable project, we're going to talk about impact, novelty, and feasibility. So first of all, how do you generate a research question? My advice would be that you look around you. So for those of you that are residents, it's probably not as applicable to you. You will hopefully be working with a mentor that will have gone through this exercise and identify a research question for you that is relevant to his or her interest. But for those of you that are mentoring residents or have an interest in pursuing your own research, especially if you are in academia, then my advice is look around you in terms of what are your daily activities, what is a common type of disease that you have in your caseload, for example, and try and be inquisitive about how you approach your daily practice, whether it's in the clinical setting or in the teaching arena. Just ask yourself, what issues am I facing? What could improve the outcomes? What do I not know? That's very important. Identifying your gap in knowledge is the first step toward filling them. Why do we do things this way? So challenge paradigm, and residents are usually extremely good at that. And you should feel proud about asking questions and challenging established norms. What would happen if we tried something different? Okay, so try and think different. When you have an idea, then you're going to try and check your idea through a scoping review. In other words, you're going to look at the literature to see if your question is still relevant and novel. And you're also going to look at what tools do you have to answer your questions. So what would it take for you to be able to answer the question you generated? The sweet spot, and I've taken here a drawing that comes from the business concept, but applies to creating and generating a project, is you want to be right at this overlap between having an idea that you feel is relevant, is going to have impact, is still novel enough, and yet can be addressed through whatever you have available for you to test the hypothesis. So that is the big difference between intentional studies versus convenient studies. In an ideal world, you want to be doing intentional studies. Those come from the process that I've just described to you, where you identify an issue that affects, for example, your daily practice or is a common complication among your, in your caseload, in your experience. You identify a question, you identify what is not known from the literature. That's what we call the relevant gap in knowledge or the limitation in the current standard of care. And then based on this, you formulate a hypothesis to improve the current status. You also need to have a rationale as to why you may be able to improve your daily practice with whatever novel surgery or tool you're planning on using. And then you select a methodology to test your hypothesis. These are the best studies because you start with a question of impact. This is not, however, always the reality. The reality is, especially for residents, you are on a 3-year program, you need to have a publication accepted by the end of your training. And same if you're mentoring a resident. I would argue that the pressure is even higher if you are in that situation because you feel committed to your trainee. So for that, we sometimes have to look at convenience studies. So convenience studies are driven by the need to publish and by what is feasible within your environment. So it may be an availability of data, it may be caseload, it may be availability of a diagnostic tool. And based on this, you are going to identify objectives, hypotheses, and then you have to derive your impact. So that is kind of a reverse process, if that makes sense. But the challenge you have with the convenience studies is you have to identify some form of impact to improve your chances of publication. So then you can look at the evidence-based medicine hierarchy. What are the best type of studies? So certainly this is a pyramid of evidence, and the type of work listed on the top of the pyramid is the one that have more impact. So, however, there are sometimes the one that takes more time or are more costly, such as a controlled trials. They can be also riskier. So to establish your track record, so that includes residents or young investigator, you may want to look at observational studies. So those may be cohort, case control, cross-sectional studies, and perhaps get into the control trials as your long-term achievement plan. However, for journals, we are especially interested in the meta-analysis, the systematic reviews, the controlled trials, because those are most likely to get cited in future work and therefore boost the impact factor. Whatever your work is, you want to try and emphasize the impact and the clinical relevance, sorry. So impact is, for example, if you're working in a field that is a bit more basic science, but still related to surgery, you're looking for impact in the field. If it's a clinical project, you're looking for clinical relevance. You have several opportunities throughout your article to discuss this, and we'll go back to this concept when we talk about the article, but you need to think about those when you think about your study, about designing your study. So you will be able to state the importance when we go through the introduction about the general issue or the disease that you are tackling, when you talk about the gap in knowledge, why this gap in knowledge is an issue, or why the limitation in the current standard of care is an issue, and then in your results section. So this is going to go through the abstract, the introduction, and the discussion. Now, a few tips to select your research question. First tip is to avoid the yes or no types of project. So a yes or no type of project could be to evaluate whether a new implant is stable in a bone model. And that's not even a really good exercise, but let's say that's not a good example because it depends with how you define stable. But say, let's see if a new drug improve the outcome or not. This is kind of a yes or no. You have to be careful about those because if you get a no answer, you may be disappointed. Public journals have become better at publishing negative results or lack of differences results, but it always puts you at an advantage if you start with a question that you're going to be able to answer and publish no matter what the outcome of your project is. So for that, open questions may be better. So an open questions may be to determine the impact of a new suture on the infection rate of such a procedure. Something that is to determine the airflow across the larynx of a dog. Then again, you have to make sure that you translate this into impact. And then the other option is to, when you formulate your hypothesis, try to think about testing directional differences. In general, it makes sense that you are trying to make a difference with your research. So it's not very intuitive to start a research expecting no difference, if that makes sense. Unless, for example, sometimes we will have projects that are going to show this is a new implant and it's going to function as well as the current standard of care, but it costs less and it allows to shorten the duration of surgery. So note that in this case, this is what we call a non-inferior type of hypothesis. You want to prove that what you are testing is similar in some regards to the current standard of care, but it still has some advantages. Okay, so when you start thinking about a project, again, it's a lot more intuitive to think that you are going to make a difference one way or the other, and therefore try to focus on testing a difference rather than showing a lack of difference. Okay, so again, when you think about crafting your objectives, and again, this slide also applies to when you're preparing your manuscript, but really when you're preparing your manuscript, you're behind the ball at this point. So what I would encourage you to do is to think about how you're going to craft your objectives at the time that you design your study, so that then you're not trying to sort of backtrack and figure out, you know, what kind of impact can come out of this. So I understand that convenience studies, you know, is bread and butter for a lot of the residents or the short-term project. Interns are in that boat as well. But again, make sure you think ahead of time how you're going to craft your objectives to convince the reviewers that your article needs to be published. So the objectives should fill the gap in knowledge. So obviously what you have identified as an issue should be addressed through your objectives. How you craft your question is actually quite important and can tell quite a bit about the impact of your study. Try to craft your question so that it answers the why did you do this study rather than the how did you do the study. The how is a statement of means. The why is a statement of goals. So for that purpose, you're going to use action words oriented toward outcomes. You want to try and avoid the use of explore, develop, design, because these could be read as fishing expedition. In other words, you had no clue what you were going to find. You're just testing different things just so that, you know, you're hoping to find something among everything you're testing. And also avoid compare, because compare often refers to a mean. For example, comparing the biomechanical strength of this plate, this locking plate versus this locking plate. That's a mean. That's saying how you did the study. That's not saying why you did the study. So why you did the study may be to test the influence of using these special screws on this plate to improve, so to determine the ability of these screws to improve the fatigue failure or fatigue resistance of a construct, for example. Okay. All right. So with that, why do I already have answers there? Okay, so the question here is, which of the following statement would best describe the objective of a study? A, to determine the influence of a new implant positioning device on limb alignment after percutaneous LCP fixation of femoral fractures. B, to develop and test a new implant positioning device for percutaneous LCP fixation of femoral fractures. C, to optimize limb alignment after percutaneous LCP fixation of femoral fractures with a new positioning device. Or D, to compare limb alignment after percutaneous LCP fixation of femoral fractures with or without a new implant positioning device. Let me see if I can go back to my previous slide. Okay, there you go. Good. Huh. Okay, all right, very good. So most of you have answered A, to determine the influence of a new implant positioning device on limb alignment after percutaneous fixation of femoral fractures. This is the correct answer. B, obviously, to develop and test a new implant. That's too vague for a statement. To optimize. So some of you have picked optimize. The reason why I put that in there is because optimize is used fairly frequently or occasionally, but it's a very dangerous word. Optimize means it's the best outcome, right? And you cannot make that statement unless you have tested every single possibilities, which is usually not the case in research. That's why we usually stay away from the word optimize. It may be your ultimate goal, but it's a goal that is almost impossible to achieve. And to compare limb alignment, so again, there you are talking about how you're going to test the implant. So you're going to be comparing limb alignment, but really your goal is to try and improve the limb alignment ultimately. So to determine the influence is a better choice than to compare. Okay. So these are my backup slides. All right, very good. So now your hypothesis should match your objective. That seems intuitive, but sometimes it's not the case. It should be testable within your study design. It should be accepted or refuted in the discussion. So what this means again is at the time when you're thinking about your project, you want to think about all these elements. What will be the objectives? How would I write the hypothesis? And again, just like I suggested, aiming for a directional project, you're going to be aiming for a directional hypothesis rather than a null hypothesis. If you use a null hypothesis, then it is especially important that you justify your sample size to address type 2 errors. So again, type 2 errors are those where perhaps you have too much variability between your samples relative to your number of subjects enrolled to be able to, for sure, say there is no difference by opposition to there may be a difference, but I don't have enough of a population to detect the difference, if that makes sense. Then you also, it's a good idea to provide a rationale for the hypothesis. So to base your hypothesis, there you can use published evidence. It could be comparative data compared to humans. It could be your clinical experience, or it could be preliminary data. Okay, all those are good to think about your hypothesis. Okay, so we're gonna move to the second portion of the presentation. Now that we've talked about thinking about your project and trying to identify objectives and a hypothesis, we're going to talk a little bit about designing the study. And again, you know, being aware that I cannot cover all the different types of studies during that time, but just giving you a few pointers about things to think about. So again, we're going to look at designing a study that meets the objectives. It needs to be feasible within your time frame. We're going to talk a little bit about team science and enrolling collaborators. And then we're going to talk about ethical use of animals and human subjects, because this is essentially designing and setting up your study. Okay, so my advice to you would be to take the time to draft a proposal, even if you do not need to seek funding. Obviously, if you need to seek funding, you're going to write a grant and you're going to go through this exercise. But sometimes you don't have to do that because there is already funding available. But if so, I would still encourage you to sit down and think about that checklist. So we're going to be aiming for a sound methodology that, again, address the objectives. I know it sounds intuitive, but for example, not so long ago, I remember a study where the investigators were proposing a new technique that they claimed was as efficient as the other one, and could, and then in the rationale, in their introduction, they were mentioning, oh, this technique would minimize blood loss, for example, but they did not measure blood loss in their study. They evaluated other aspects. This was, well, so it was, for example, this technique has been shown to minimize blood loss in human patients, therefore, you know, we'd like to try it. But if this is the proposed advantage, you want to make sure you test that advantage in your study, because obviously this was your rationale. So make sure, again, that you address the objectives. So you should have a logical flow between what it is you want to study, the objectives and hypothesis, your study design, and what do you expect for your results. And that will trigger the impact that you expect. Okay, then the next questions to ask yourself is to identify groups. The veterinary literature is not very good at having control groups compared to the human literature because of, you know, obvious reasons. It's difficult to get follow-up, it's difficult to recruit cases. I think we do a better job in the experimental arena, but certainly in the clinical area, it's not easy. But there are ways that you can use control groups. For example, you can use historical match control group. If you have changed the way you do things by one variable, so for example, you're using a standardized checklist for anesthesia, that's just an example, then you can use your historical control. You can match them based on some variables. So for example, age or gender or surgeon or type of surgery, whatever you feel relevant, and you can still have somewhat of a control group, if that makes sense. The other consideration is your number of subjects per group. And for that, I would highly encourage you to enroll the assistant of a statistician right from the beginning, so that you're not trying to scramble what should my group size have been when you find no difference at the end of your study. So sometimes it's difficult to do that. It's not really possible for you to do that. For example, if you're doing a retrospective study, although in a retrospective study, you could argue that the duration of your study, in other words, how far back you go to get your cases, or you could recruit cases from other surgeons to increase your sample size and test whatever hypothesis you have. It's difficult to justify your sample size if you have nothing to start with. In general, you need to have some parameters that you know you're going to be evaluating. You need to have like an average or a mean and an idea of the variability in the group, or you need to select, I want to identify a population that would allow me to detect, say, a 10% difference in the outcome. But I would encourage you to think about that and go through that exercise. Then also identify your measures of outcome. So preferably consider objective data and clinically relevant. There is no excuse for not having goniometry as part of your assessment of a surgical treatment for orthopedic disease. It's a very simple tool, everybody does it, and yet it can be, it's clinically relevant. Same for patient validated questionnaire. It's very easy to use. Okay, those may not be 100% objective. It's not as objective as pressure gate analysis, but it's clinically relevant. So try to think about a mix. If your objective data is not really necessarily going to be clinically relevant, or you're going to have to, extrapolate, then consider complementing with your clinically relevant data. And then finally, your duration of follow-up. So again, it depends on your objectives, and it will depend on the condition that you are tackling. So again, second step, once you have sort of decided of the design of your study, and enroll the assistants. So complementary expertise makes sense. For example, if you're doing a study related to imaging, it's a good idea to have a specialist in this field working with you. Statistician, definitely, for justification of sample size and anticipating how you will analyze the data. And potentially you may need to recruit additional collaborators to generate the caseload you need to complete your study in a timely manner. You may also want to look at the guidelines on reporting at the time when you're designing your study. Those have been published by the Equator Network, which is the Enhancing the Quality and Transparency of Health Research Network. It's a committee that has essentially established some guidelines as to what should be reported. And the rubrics that we have designed for our reviewers reviewing articles submitted to veterinary surgery are taking into consideration some of the guidelines that are proposed by the Equator. So these guidelines also includes original research, retrospective studies, even case reports. So it's a good idea, it's a good resource for you to look at their websites, and they literally have checklists of things for you to consider. Anticipate challenges. I'm afraid to say, if you guys have not engaged in research yet, none of my research projects have ever worked out the way I anticipated when I started. There's always something that you will need to troubleshoot. So if it's a retrospective study, it's less risky, but if there is an experimental or clinical component, you can rest assured questions are going to come up. And this is what makes research fun, honestly. So for clinical studies, you can anticipate difficulty with enrollment. So if you're looking at doing such study, I think it's a good idea for you to plan for incentives for owners, and even maybe for staff or colleagues that would be working with you and help you generate the data. Advertising. If you are trying to recruit cases, advertising is a big part. It may be advertising to the community, advertising to referring vets, and then enrolling in collaboration. We're now seeing an increased number of multi-institutional studies, and that is a good thing for us. Another challenge with clinical studies is being able to accurately record data while on clinics. So, very often these cases will come in during your clinical duties, and having to try and dedicate time to make sure you record the data at the same time as you're managing all your other cases is certainly a challenge. So consider inquiring about technical support to help you with that. Loss of follow-up is obviously a common issue with clinical studies, and complications. So for example, you're testing I don't know, a new treatment for patelloexation. So you are randomly assigning your cases. How will you manage the cases if there is a complications? Do they stay in your trial? Do you exclude them? So you want to plan all these things before you get started. In experimental studies, same thing. The troubleshooting will be there. It's just that the nature of the challenge will vary with the experimental design and the methodology. So for example, something as simple as one of my initial projects as a junior faculty was to test a bone cement, a resorbable bone cement for screw augmentation. And we were testing those in radii of cats as a model for toy breed dogs. And it didn't occur to me that the cement was so thick that it would not inject into the hole and would not go through the gauge of the needle. So I had to, it was a minor thing, but it's something I did not expect. So we had to troubleshoot that, use a bigger needle, cut the length of the needle, and work with the manufacturer to adjust the viscosity. So as you get a little bit more senior and familiar with your experimental setup, you will be in a much better position to anticipate challenges. If not, if this is your first time using a certain tool or methodology, make sure you look up on the literature. And I'll be honest with you, authors do not let you in on their little secrets. They will not let you in if they have, if they encountered some unexpected challenges. Usually those details get excluded from the paper, but you may be able to reach out to the author and ask by email. You may be able to ask for advice. And finally, look for input from collaborators and consider preliminary essays. So something as simple as injecting the cement through a syringe may help you identify some potential challenges. Okay, so finally, the timeline in terms of designing your study. So there are two ways of planning your research. The one way is the forward planning. So you start with your idea, you have an idea, you plan how you're gonna address it. So you're going to have to seek funding, then that's at least 3 months, depending on the mechanism that you're applying for. 3 months would be for an intramural. If you're looking at a foundation, you're more looking at 6 months to a year. Then you have the setup, so ordering your supplies, getting your IACUC approval, that's about 3 to 6 months. Then you go into a phase of data collection, which again is going to depend on the nature of the study. And in general, will be longer if you have intentional studies, especially clinical prospective studies and new bench research, because you're going to have to troubleshoot the methodology. And then you have the third phase, which is the data dissemination. So that's doing the stats on your data, drafting the paper, going through internal reviews. And realistically, that takes about 6 months to a year. Then you send it off, you have reviews and publications, and you can look at 6 months to a year. So you can see if you add up the numbers, you are over 3 years. So those studies tend to be the most impactful because they're usually intentional studies, but they're also the most uncertain. So they're more exploratory and they may be more suited if you're looking at a long-term impact. So for example, I think this is a good strategy if you're just maybe a junior faculty and you're starting your research, you want to have a long-term plan with a really good study that's dear to your heart. That is this one, but at the same time, you're going to be running some shorter term project. And just as an FYI, I have included here the current timeline for VetSearch. So it's 200 days from submission to acceptance, and that's the median, 230 from submission to online publication. But notice the variation, it's from 100 to 800. So 800 is, those are outliers, but I'm just saying as a rough guide, count about 200. So you can see we're not far from a year. So as I mentioned, there are instances where you're going to be looking at a faster track, and certainly for the residents, that's very relevant. So in this case, you're going to work backward. You're going to work from what is your endpoint? Your endpoint is to have your publication, and you want to have it accepted before the end of year 3, your residency. So your goal, then you work backward. So to achieve that, you want to submit by the end of December in year 3, which means you're going to be drafting the paper around summer, fall of year 3, which means you need to have your statistical analysis done around the winter, spring of year 2. So if you keep going backward, then that means you have, for data collection, is going to, realistically, ideally, you want to start it in year 1. It's going to be between year 1 and year 2. And you're going to be looking probably at studies that are much less risky than the clinical prospective studies. So that's going to be your retrospective studies, your validated or low risk experimental studies. So low risk means it looks pretty established, or your mentor has already some practice with some aspect of the methodology. And you want to start the data collection by the end of year 1. So again, if we move up, that really means you have to identify your mentor with a funded project, or you need to seek internal funding in fall of year 1. And then you need to plan ordering and doing your ICOC and what else is needed, in other words, the setup in the winter and spring of year 1. All right, so let's see. Which stage of the process are you currently in? So I'm not quite sure why I already have so many answers, but it looks okay, good. I see that the poll is moving. So yeah, we're in fall, so it doesn't surprise me. I would expect that probably the year 1 resident are in the phase of still seeking ideas and formalizing their project. And then the year 3 should really be in the process of drafting a manuscript. And I'm assuming the year 2 would be somewhere in the analyzing data. And I guess I didn't put collecting. That's a bit of I forgot collecting data. My apologies. But that would be under analyzing data. All right, very good. Okay, so that makes sense. All right, so moving on, we're going to talk a little bit about team science. Team science means you're working now within a team. And as you can see here on this graph, it's pretty common across the fields. And we're seeing an increase in the number of co-authors on papers, where now we have an average of 6 authors per article. So if you are finding yourself in a situation where you are starting to think about ideas, creating your project, designing, you want to think about collaborators. Keep in mind that the essential part that your collaborator must play is an intellectual contribution to your project. Okay, so that's why I've put that in the center of the slides. Then on one side, you have sort of the logistic and the practical aspect. The other side, you have the human qualities or the characteristics that you would be seeking in a collaborator. So if we look at the logistical support, you're going to be looking for complementary expertise. For example, an engineer in biomechanical testing. And you're going to be looking at caseload. That may be the rationale for having a multi-institutional study. You may be looking at equipment. For example, you may be looking at thermal imaging, or somebody with obviously testing machine or a gait analysis lab. And then on the other side, you have the human qualities, which are as equally important for the success of your project and to avoid a lot of headaches down the line. And those can be a little more difficult to evaluate at first. Trust takes time to build. Reliability, I think you can get some red flags fairly early if people don't get back to your email in a in a timely manner, or they commit to showing you something in their lab and then they don't. So you can get a feel for that. I think one aspect that you can evaluate right off the bat is the presence of conflict of interest. That's not to say that you cannot work with people who may have a conflict of interest, but that means you need to put those on the table and deal with them before you get started. So conflict of interest would be, for example, 2 first-year residents working on the same projects. You both need publication as first author. You're going to have a conflict. It would be, for example, doing a project for a company. Huge conflict of interest. The companies are used to discuss those upfront. In the academic arena, it may be two junior faculty collaborating together. Who's going to get the lead authorship? So those are things you want to discuss right up front. Do not make assumptions. Assumptions are the termites of relationships. I do understand that those can be difficult situation, difficult conversation, that you may be uncomfortable, especially if there is a situation of power. But trust me, you need to pull yourself together, go through that conversation early before you really get too far into the project. If not, you are opening up yourself for deceptions and breakdown in a collaboration further down the line, which will be a lot more detrimental than if you were not able to get an agreement right off the bat. Okay, so try to solve this right up front. Set expectations. Also, my recommendation would be that you summarize them in writing, either through minutes of a meeting or through a document. Again, if you go through the exercise of writing a grant, outlining the respective roles is part of your grant. So you want to clarify who will be recruiting cases, who will be doing what in the data collection part, in the data analysis, who will be drafting, providing a critical review, inline editing. For the residents, you do need someone to do inline editing for you, and who will pay the publication fee. You may also want to discuss support to present your data at conferences. Then you want to discuss the expected outcomes. So that's true on grants. For example, if you have grants that are derived from this work, who would be the PI or the co-I? Who owns the intellectual property, or what aspect of the intellectual property belongs to each collaborator? Same thing with funding. Do they expect funding? If you're expecting funding, how will the funding be shared? So for example, for my faculty, when they have a grant submitted with a faculty in another college on our campus, I will ask them to submit an internal budget that clearly shows how the funds will be distributed between the two labs. It's an informal document, but I think it states the stage, and it makes sure that, you know, we don't have problems down the line. Royalties, if your work, if you expect royalties or a patent or something out of that work this out ahead of time. Presentations, who will be presenting what? How will that be supported? Any publication relation use. For example, if a practice is planning on having video clips of the project on their website, is that okay? How would you work this out? And of course, the big one is the authorship. That's the big elephant in the room. So we're going to run through a few examples about co-authorship. So Professor Tournesol is the head of a department, and he should be a co-author as he provided access to his laboratory for some of the experimental experiments, and he read the final manuscript. Okay, I got a 50-50. Okay. And I lost the 50. Okay. All right, very good. So the answer is false, because there is no intellectual contribution. So to qualify, the providing access to the lab is fine, but the professor should be also supervising the experiments or collecting part of the data or interpreting the data, and definitely needs to have provided a critical review of the article. Okay, next scenario. This is a reminder of the International Committee of Medical Journal Editors Guidelines. These are the guidelines that we follow with veterinary surgery. So the authors should have made a substantial contributions to the conception or design of the work, the acquisition, analysis, or interpretation of data for the work. So this is the intellectual contribution piece. And drafting the work or revising it critically. So we need to have a critical review of the manuscript and a final approval of the version to be published. And then they added a few other elements, such as agreeing to be accountable for all aspects of the work and also being aware of who's done what in the project. Okay. So here's another example. Dr. Fixit should be a co-author because he was primary surgeon on more than 20% of cases included in a retrospective study. This was a multi-institutional study. So I've got false 100%. Okay. This is correct. It's operating a case as part of clinical duties that not in itself contribute to the intellectual content of the study. Now, if the surgeon actually gathered the data or analyzed the data and shared it, that could count as a scientific contribution. And then, of course, there needs to be a critical review of the article. Dr. Gocha analyzed the data and produced figures for the study and should therefore be listed as a co-author. True or false? 100% true. Okay, that's a common situation. It's your typical statistician helping you on the study. However, the statistician should review your results, make sure that you have accurately transposed their statistical output. They should also review and, if not right, the data analysis section in the methods that explains how the data was analyzed, and they need to provide a critical review of the entire paper. So in this case, there is ground for co-authorship, but not as described. There are some missing elements. Okay, finally, Mr. Kervet, our VT, should be co-author as he collected the pressure gate data for the study. False. Okay, so I think you're getting the gist here. Oh, I get a 50-50. Quickly disappeared. All right, so you get the gist of it. So this is an RVT who collected data. That happens quite frequently in the clinical world, but if you want to give that person co-authorship, you have to involve that person in other aspects of the manuscript, including providing an intellectual contribution to the content of the paper. So that includes the critical review of the draft, final approval of the paper, and perhaps a little more than just collecting the pressure gate. It may be a matter of extracting the pressure gate data from the machine or combining it, something like that. Okay, finally, last one. Professor Big Bill, COE of Vet Stuff Incorporated, designed the study and provided the funding, thereby justifying co-authorship on articles derived from the work. False. So again, by designing the study, there is an intellectual contribution to the study. So that counts, but that person should also provide critical insight into the draft and approve the final version. So as written, the answer is no, that in itself does not justify co-authorship. Okay, so this was my backup slide. All right, so the bottom line is, I hope through these exercises and examples, the message that I'm trying to convey is keep your collaborators engaged throughout the project to make sure that they fulfill all the criteria for co-authorship. Okay, so team science, we do see that in the veterinary world in two big scenarios. I think that's an emerging trend, definitely. Multi-institutional studies. So again, for veterinary surgery, we ask that the authors clarify the number of cases provided by each author as primary surgeon. And what we mean by that is we understand that the primary surgeon would be the one collecting the data and providing the data on the case, because just reading the case does not constitute intellectual contribution. We also ask for that information because it has some epidemiological value. If you have a 50 cases and they are equally split between 3 surgeons, whereas if you have, again, 50 cases, but 40 are from one surgeon and 5 and 5 from the other 2, it does not have the same epidemiological value. Similarly, in the educational world, just teaching a class or a lab as part of teaching duties does not imply co-authorship. Collegiality and would imply that, however, if you had a colleague involved in, doing surgery on some cases that you're planning on using for your study, or teaching a class that will be part of your study, that you would engage that person in the study itself so that they meet all the criteria for authorship. One more tip: if you are planning on an multi-institutional studies, sometimes we ask for evidence of that intellectual contribution, especially if there are a lot of authors and it looked like some may have contributed very few cases. So make sure you keep a records of the critical reviews that have been provided by each author. Okay, so the other case scenario that we're now seeing is work that is led by associations such as Veterinary Endoscopic Society or VSSO, for example. These sometimes are currently listed in the title, but this is not really the way it should be. The authorship is in the authorship, not the title. So all the authors listed must meet the guidelines that we just went over, which means that to list the association as an author, all the entire membership need to meet those requirements. Otherwise, the authors need to be listed under the author list. The association may be mentioned in the methods. For example, it could say cases where a call for cases was sent to all members of VES, for example. That could be under the methods. Okay, we're going to move on to animal use in research. And again, those are part of setting up your research. So in a nutshell, the issue surrounding animals is that of permission for experimental in vivo research. I think everybody knows that you need an institutional animal care and use committee review and approval. For cadavers, it's not as clear-cut. For veterinary surgery, we require that authors disclose the origin because we want to eliminate any appearance of experimental use of cadavers in private practice or, client-owned pets that have been euthanized or died at a clinic. The need for an IACUC depends on the institution, so we don't necessarily require this. For a prospective clinical study, we require the IACUC as well as an informed consent form for clients. So I would like to trigger your attention to this article, which is an excellent article published about specifically the use of animals in clinical trials in privately owned animals. And in that paper, any collection of clinical data where the intention is to communicate information about the clinical practice may be described as clinical research. So this will serve to trigger your attention as to whether your proposed project will fall as clinical research. And if you intend to publish it, obviously, yes, it does. So with that, we're going to go through a few examples. Dr. Goodvet would like to evaluate a new resorbable mesh for perineal hernia repair in her practice. Which of the following is true? Since perineal herniorrhaphy with a mesh is an established treatment, owner's consent to surgery will suffice. An informed consent form to enter the study must be developed, but the IACUC review is not needed since this study treats affected dogs. IACUC refers to committees in institutions and are not relevant to research in veterinary practices. And IACUC approval must include approval of the informed consent form that owners will sign. Okay, so I have majority of a D. And this is correct. I could see why you went with A, but here it's a new bioresorbable mesh. There is an intent to evaluate the technique and report it. Therefore, you would need to have to consider it as a clinical research. Okay, this was my backup slide. Okay, so how can you organize an ethical review if you are in private practice? You can create your institutional animal care and use committee. You need to have at least 5 members and one veterinarian with training and experience in lab animal who has experience and responsibility involving animals in an institution, 1 practicing scientist, 1 member whose primary concerns are non-scientific, 1 member who is not affiliated with your practice. And obviously, there need to be no conflict of interest with any of the researchers or study. If this is not an option for you, you can approach a collaborator at an institution and go through the institution, or you can purchase ethical review services. So because you're in private practice doesn't mean you cannot get your IACUC processed. Big piece of information here. The informed consent form for research is not a consent form for treatment. I think that sometimes some authors get confused and they say, yes, it was with owner's approval. This is a different type of approval. So it needs to have a statement that explain the project and that participation is voluntary. There need to be a description of the procedures of the project, of the risks, potential benefits, and alternative procedures or course of treatment, if any. And these forms need to be reviewed and approved by the ethical committee before you start your project. So moving on to another case scenario, this is a Dr. Hockney who intends to test the presence of a novel marker in excess synovial fluid. Samples would be obtained during the diagnostic workup of horses with infectious arthritis and would be subsequently stored in a bank. Which of the following is true? You need an IACUC and informed owner's consent. Only the IACUC approval is required, only the informed consent is required, or you do not need anything. I just have 100% for IACUC. Okay, so in this case, actually, you do not need approval because it's an excess synovial fluid. So in this case, you basically do not need the approval unless you need to collect more fluid from that joint than you would just for the clinical management of the horses. Okay, so these are samples that were collected as part of the regular management, irrelevant of the study, and they were stored and there were some leftovers essentially. So for that, you do not need an approval. Okay, what about retrospective studies? I have a few examples here. The first one, it's a review of medical records of dogs who underwent TPLO to prevent cranial cruciate ligament disease. Would that be publishable without IACUC and consent form? Okay, I see 100% true, and the answer is no. I know it's a common mistake. You think you're just reviewing medical records and that's okay. But the issue there is that TPLO has not been established for prevention of cranial cruciate ligament disease. So the question itself is really a research question that would have been better addressed through, or should have been addressed through a prospective clinical trial or an experimental trial. Does it make sense? So be careful. It is sometimes authors try something new in the clinic and then they choose to review the record. But if it's too new, that's going to be potentially considered as experimentation without IACUC approval on client-owned animals, and we will not be able to publish the results. So how about that? A review of medical records of cats undergoing thoracoscopic lung lobectomy with a new stapler. Would that be publishable without IACUC and consent form? I get 100% false. And I think in this case, we would take it because thoracoscopic lung lobectomy is established. Just using a new stapler, we would consider that okay because it's a minor modification of an established technique. So the equivalent would be somebody testing a new type, reporting on a new modification of a TPLO plates. And those papers have been published because the basic technique has been established. This is a minor modification. A review of horses treated with inferior check ligament dysmotomy and assessed after surgery with force plate analysis and histological examination of a biopsy. False, and that is correct because in this case, doing the force plate analysis and the histological examination of a biopsy would not be part of your routine clinical management for that horse, okay? Okay, so this is basically a summary of what is a retrospective study. It's an observational studies, i.e. no test or procedure is done for the purpose of the study, and there is no intent to report results at the time of treatment. If you find yourself in this situation, you do not need the IACUC approval or informed consent form. However, be careful that if you're using something a bit novel, that there is prior validation. So you do not want to have an inadequate study design to address your question, if that makes sense. So keep in mind, no test or procedure done for the purpose of the study, no intent to report at the time of treatment. Okay? All right, very good. So finally, last question, a review of survey responses of surgeons using ergonomic instruments. Would that be publishable in VetSearch without IACUC or consent form? True. This is a bit of a tricky question. In this case, we would require an IRB review. So because effectively your subjects are humans, you are testing the surgeons. The surgeons are involved in the project. So it's an enrollment of human subjects. Granted, it's a survey. So what that means is the institutional review board would probably find the study it would find the study exempt of a full review, but it should still give you some form of approval. So that's a common mistake that we see. You know, you try to do research, you got a bunch of colleagues, you get together and you try a new stapler or something and you don't have any IRB. That could get you in trouble. It's also not a very good study design to use your collaborators as participants. Technically, the participants in the study evaluating the tools that you're using should not be your co-authors and your collaborators. All right, this is the end of part one. So I think we're gonna see if there are any questions. Maybe Amelia?
Thank you, Dr. Verboom. We did have one question in the chat that came up a couple minutes ago, and the question was, what is the downside of including the association in the title? The authors involved are listed in the author line. It implies that all authors are members of the association and gives recognition to the efforts of the association. What are your thoughts?
This is a tricky question. We discussed it among editors during our October meeting. It's not the place, so it's not following proper publication guidelines to put what could be considered as authorship into the title. So that's just a matter of publication ethics. But we're still allowing, so you could still list it as a group authorship. It would not be in the title, it would be as author if all the members meet the criteria. If not, we are still allowing it in the methods, which the methods are in the abstract. So the name of the association which would still show up. It just wouldn't show up in the title. And I know we started doing this. This is sort of a new concept. I looked into this, and that this is the recommendation that I received. Any other question?
I don't see any additional ones in the chat at the moment. So I guess we can move on. And if anybody else thinks of another question, we can bring that up in the next break.
All right, very good. Off we go then. So now we've talked about the designing, we've talked about the study design, the setting up. We're going to jump to once you're done. So how to choose your journal, what to look for, what to avoid. First question is, you want to find a journal that would be the right fit. And so for that, looking at the journal website is going to be important. Look at the mission and scope. Look at what is the audience you're targeting. The impact factor, we talk about it a little bit later. We'll go over that. Look at the timeline. How quickly are the papers published? If you're not sure, feel free to drop a line to the editor-in-chief or the managing editor. And finally, the type of publication and the cost of publication. So those are the items you're going to keep in mind. The scope, that's pretty simple. If you've never published before, obviously this is a seminar for surgeons. So, obviously veterinary surgery, veterinary comparative orthopedic traumatology. I mean, I'm sure you're familiar with those. What if you are publishing something that is more in basic science, biomedical sciences, or technology or biomechanical? I think a quick tip is to look at the journals that keep coming back in your reference list. That would be a good first indication that those journals may be of interest for your publication. Okay, so then you visit the website of the candidate journals, look at the mission statement, and for veterinary surgery, I think I'd like to clarify that we are interested in work that is relevant to the broad field of veterinary surgery. So that includes clinical studies as well as basic science, as long as there is relevance to surgery. You may want to also, if this is a journal you're not familiar with, look at the titles of some of their recent articles to get a feel for what kind of science they're publishing, and then specifically look for some articles that are relevant to your field within that journal. So the audience you're targeting, it depends if you're targeting the general practice or the specialist. I think in our little world, you're going to be looking at JAVMA, that's a generalist, Equine Vet Journal, JAHA, JSAP, Vet Record, BMC. Those are more targeted for the general audience. For surgeons, veterinary surgery, obviously, VCOT, those would probably be your top two, equine surgery as well, or Equine Vet Journal as well. For surgical education, Journal of Veterinary Medical Education, and also we are now publishing quite a bit of articles related to surgical education. If your paper is more experimental, basic science, you could look at AJVR, or else this is where you'll be reaching to journals specific to your field of research. So at this point, you're going to reach beyond the veterinary community. So if you are an intern looking for a residency, you may be better served trying to publish in the journals that are mainly read by surgeons. If you're trying to make your niche in the world among biomedical engineers, then you want to reach beyond the veterinary community. So just be a bit strategic about the audience. The impact factor is not really that big of a deal. Most veterinary journals have an impact factor oscillating between 1 and 2. The data in this table is not recent. VetSearch is now at 1.4 something, but it just gives you an idea of where the impact factor stands in veterinary in veterinary sciences. The timeline. So the timeline for veterinary surgery, we provide the timeline in the business report for the diplomates every year. And we provide the timeline to the board, I think every 3 times a year. They get a report on our timeline. If you don't have access to this information, then you can look at recent articles and you can see when they were received, when they're accepted. If it's a journal that you're not familiar with, you can reach out to the editor-in-chief and just inquire about that information. Okay, finally, types of publications and costs. So there are now 3 types of publication. The traditional model, which you know, I'm sure you're all familiar with veterinary surgery, where you get your printed version. In this case, the readers pay for the subscription, the authors pay a fairly low cost. I believe it's around 50 pages per paper. So you're looking at about $800 for your publication, depending on how long it is. And the journal owns the copyrights. This is a traditional model. There is an intermediate model, which is the free access. So with that, it's an online publication. The public has free access to your information. The journal keeps the copyrights, and the authors pay the cost for printing, for publishing. So for example, this is the model for our minimally invasive issue that we publish in veterinary surgery, which provides free access for 6 months. And the cost, actually, the cost for publishing is the same as the traditional cost. So it's a pretty good option to consider. Finally, the most recent type is the open access. So this is where it's free for the general public to access the information, but the authors pay the publication fee. These journals are typically online, so they do not incur the cost of printing articles, and the authors keeps the copyrights. Okay, so can you rank the following parameters based on their influence on your journal selection before we move on? I have high acceptance rate, fast review, impact factor, audience, for example, surgeons, prestige in the community, publication cost, accessible to readers at no cost. I am not seeing any response. Ah, there you go. Wow, that's interesting. Okay. All right, publication cost is your first. So if so, and oh, now it's changing. Surgeons. Okay, so it's between audience, surgeons, and fast review counts as well. All right, that's interesting. Okay, very good. Okay, so essentially what I'm getting from this is that accessible to readers at no cost, in other words, the open access is not really that important to you. The audience, that probably reflects the fairly large number of residents we have in this webinar, as well as perhaps some junior surgeons who are trying to establish their track. All right, very good. Fast review. Yeah, so we knew about that. That was one of the charge put on me when I took over the journal. We've made progress. We're still at 200 days, but realistically, if you're looking at a traditional journal, this is pretty, this is not the fastest, but it's okay. It's reasonable. So with a traditional model, the publisher has several responsibilities, which includes the typesetting, the printing, the distribution, enforcing copyrights, and the publishers pays all the costs for these activities. And typically the journal will also go through an editorial or review process. For VetSearch, it's a double-blind review process. That means that the authors don't know the reviewers don't know the authors. With open access publishing, it's defined as the free, immediate online availability of research articles coupled with the rights to use these articles fully in the digital environment. So this stemmed from the fact that the NIH was trying to make the data that was generated with research paid essentially by taxpayers available to the taxpayers. So it stemmed from a very good intent to make the information accessible. However, it has become somewhat of hijacked because the publishing cost becomes revenue, and with the online open access, the cost of publishing have dropped to where it can be a viable business, and that has created sort of a new business model called predatory journals or pseudo journals or deceptive journals. And so if you guys are considering publishing outside the traditional journal, you need to be aware of those. And I'm aware that the Resident Credentialing Committee has recently accepted some of, not predatory, but the online open access journals are becoming accepted for credentials. So just be careful about what you're trying to publish in. So essentially what happens with the predatory journals is they kind of hijack the system by publishing just online and doing minimal work on the papers, including minimum review, no editing. And so, yes, you do have a very fast distribution of the information, but it's not really vetted by the scientific community. And the quality, both in terms of the quality of the science and the quality of the writing, may not be there. So how do you identify those journals? There's two ways. There are what we call the blacklist. Beals, who was a librarian at Colorado State, started this process and created a list of predatory journals. So you can still access the blacklist. The problem was that this librarian got somewhat discredited because he was generally against the concept of open access. So then there is a bit of a fine line between, is this adversity against open access, or is this truly a bad journal? So by opposition, we have what we call whitelists, which are a list of a website that lists true and vetted open access journal. So with that, if you're just looking at a journal, how to detect those, just go on their website. Be careful of the names. Sometimes they use names that are very close to traditional fully vetted journals, but it changes by one word and it's not the journal. Their website are very often poorly designed with a lot of flashy colors, and errors in grammar and writing. The names of the editors is not there or appears to be unclear. So you want to look for a journal that has a clear list for the editor-in-chief and the editorial board. And a lot of the predatory journal are based in Asia or Africa, but sometimes they have a name or a pseudonym in the United States. They have also sometimes listed people who didn't know they were listed. I think the big difference is the review process. If they promise a review within less than a week, less than a month, there's no policies. They have a lot of special editions. Those should be red flags to you. The problem is you usually don't find out till you get the review. And, you know, I do understand that you're trying to get your paper out quickly, and but you will feel cheated if you do not get a good thorough review. You feel like, okay, it's just a pass. You're paying your right to have your information in the public domain. And honestly, it doesn't look very good to go that way for you. So you won't have the same sense of achievement as going through the regular process. Beware of metrics. These journals will also use fake impact factors that they come up with. Look for journals that are indexed in PubMed or Medline. Those are usually good journals. What else? The fees. The fees, if you are, beware of journals that are unclear about how much they're going to charge, or they ask, the submission fee depends. Some journals, some traditional journals do that. I'd say the majority do not. If the fee is negotiable, that should be a big red flag. If they offer a fast track fee, that's also a red flag. So you want to make sure that the publication fee is clearly indicated. Okay, also beware of emails from predatory journals. You will tend to receive those as invitation to publish. Here I've put an example. I received so many that I created a folder on my email just to keep them in mind. Even though I blocked the sender, they keep coming back. You tend to receive those on weekends. They usually ask for notification of receipt. They're usually not well written, although they've improved on their writing style, and they may or may not be relevant to your expertise. For example, I've received invitation to submit a paper about large animal medicine field, which is really not what I do, but they pretend like they know you and they're very impressed by your achievements. So don't let yourself be lured into this system. Just stay away. And by the way, they do the same things now for conferences as well. So if you notice here, red flags, the impact factor, the SJIF, not familiar with that impact factor. The editor's address is not a recognizable professional email address. Look at the time for response. You will get acceptance within 10 days. That's not going to get reviewed. Your paper is not going to get reviewed. And there's no signature on the editor. So in conclusion, how to select your journal. You're looking for fit. This is very, very important. So obviously for you, you're looking at surgery. You want to look at also the article format. Veterinary surgery does not publish a lot of case reports. So unless your case report is novel, well documented with an established diagnosis, a long-term follow-up, and that the treatment is clearly the best alternative for the patient, you may want to think about other options. I should say, though, that now when we reject an article in veterinary surgery, especially for case reports, if your article seems potentially suitable for another journal, we have a way of referring to an open access journal published by Wiley, who specializes in case reports, and they give you a discount on the publication if you are referred by VetSurg. I'm not saying that that's a good strategy, but I'm just saying we still try to help you out if you are publishing case reports. So look at the audience, look at the dissemination and the reach, and look at the brand and prestige. I saw that that was perhaps important for you. The credibility and the quality. Look at the peer review process. You do want a peer review. The metrics, to me, the metrics that would matter most for you would be probably the time, and second, the cost. The impact factor, to me, does not make that much difference in our field. And finally, there's an element of being familiar. Once you're familiar with the format of the journal, what they're looking for, it's very easy for you to go back to the same journal. All right, so now, in one word, describe how the thought of writing a manuscript makes you feel. And I'm trying to see if this is going to work. This is supposed to do a word puzzle. Oh, that's great. Okay, is there only one person answering? Can I get more suggestion? At least it's candid. Appreciate it. Sweaty. Okay. All right. I like it. Ready. Wow. Congratulations. Fantastic. Motivated. Okay. Vomit still dominates there. It's all right. All right. Thank you, you guys. Appreciate it. That's fun. Just wish we had more answer because I know there's about 90 of you who signed up. So I was hoping for more answers, but that's okay. I'll take the vomit. That's all right. That's exactly what I expected, honestly. So we're going to go through that. And we're going to start by explaining to you the editor's perspective, because ultimately this is who you're trying to get through. Okay. So first of all, tips to avoid the triage. When you submit your paper, it goes to an administrative staff, and then it comes to me for initial evaluation. So typical editor's perspective, we are evaluated on performance metrics such as the number of submissions, the number of articles published. That matters to the audience as well, because that means they get more information for the same amount of subscription. So they look at the percentage of rejection, acceptance, and for us in veterinary surgery, we're pretty lenient compared to some other journals. We're around 50%. Most articles that are rejected are rejected during initial triage, i.e. by me before they get to the reviewers. And that's just because I don't want to waste anybody's time, whether the authors or the reviewers. So I want to make sure that what I send to the reviewers has a decent chance of getting through. We also evaluated on the review process. We want to, have a fairly fast process, and we want to avoid complaints from authors. So yeah, we're trying to keep you happy, which means, again, we're trying to select manuscripts that are the most likely to be published. So a little bit of insight on the impact factor. The impact factor reflects the number of citations to articles in 2020 for the impact factor 2021 over the number of citable items in 2018, 2019. The bottom line is articles that are most likely to be cited boost the impact factor, and those tend to be review articles, retrospective studies with large number of cases, or novel, impactful, original research. The case reports tend to be less frequently cited because they're lower quality of evidence or weaker evidence, and therefore they tend to drop the impact factor, hence our stringent selection for case reports. Okay, so first tip, make sure you look at our instructions. We do update them about once a year, usually in January. We try to make them fairly prescriptive because, again, our goal is to make the process as efficient as possible for everybody. So make sure you look at the format requirements, read the instructions, and then make sure you've ticked all the boxes we talked about ethics. Okay, so I'm just going to add a couple of items regarding the ethics. The first one is plagiarism. I'm sure you're all familiar with what plagiarism is. You may not be as familiar with self-plagiarism, which is when you reuse portion of your previous article into another article. And that can happen, without any malicious intent, just because there are so many ways you can say how important cranial cruciate ligament disease is. For my own example. So the thing is, though, you cannot copy and paste your text. So make sure you edit the text in your own words every time you submit something. And if you see that you tend to be reusing section of a previous article, that should trigger your question about whether you are writing a duplicate manuscript. And we'll go over duplicate manuscript next slide. So if you feel confident that this is not the case, do not skip through our submission process. There is a question that says, have you done a study that overlaps? If there is any overlap, please disclose it. We do run an authenticate report on all manuscript, and that's how we can sometimes flag self-plagiarism. So what's a duplicate study? It's basically an attempt to make as much as you can out of the one project, which is Story Our Life, right? We've all done that, trying to make the most from our small grants and the little time we have for research as clinicians, but beware of not ending up with what is called a salami publication or duplicate publication. So watch for significant overlap in your objectives, in your population, and your analysis. So that's especially going to happen if you're using the same population of whatever samples, animals, to answer what you perceive as two questions. Just make sure the two questions are not related enough that if you publish one aspect without the other, you are affecting the scientific value of the publication. So let's go over an example. Okay, I'm not sure you're going to be able to read this, so I'm going to read it. Which of the following scenario would be fragmentary? So both scenarios have 50 dogs treated for osteosarcoma. But in the first case, out of this study, the first study is to report the long-term functional outcome of dogs. And the study number 2 is to report the progression of osteosarcoma in these dogs. And so for the first part, you're using gait analysis, the questionnaire, goniometry, the scoring lameness. And in the second one, you're using the radiograph, the CT, and nuc scintigraphy. Or number 2, case scenario B, same population, 50 dogs with osteosarc. Your first goal is to report the long-term outcomes of dogs based on gait analysis, questionnaire, goniometry, scoring lameness, radiograph, CT, and study 2, determine the ability of the new nuclear scintigraphic protocol to detect osteosarc. And here you're using radiograph, CT, and a new nuclear scintigraphy protocol. I have 75% feeling that A would be fragmentary, and 25% thinking B. A is correct because the progression of osteosarc is a type of long-term outcome. So both studies are essentially evaluating the outcomes of these dogs. It's just different parameters, but they're still the outcomes. And obviously, the functional outcomes may be affected by the recurrence of osteosarc. So the two studies are linked, and not having the information contained in study 2 influences or affects the scientific value of the first one. Whereas in the scenario B, the two studies are fairly independent. So one is just targeting the outcome, the other one is targeting the diagnostic tools. Okay, very good. So with that, we're going to move on. Once you have identified all the little tips to avoid the triage, preparation of your paper, the abstract is extremely important. This is what comes up on online searches. It is the first contact with the reader and the editor. And honestly, this is what I use to triage papers. So if I see red flags in the abstract, I'm going to be looking a little closer at the paper to try and find out more information. And ideally, you don't want the reviewers to do that. You want them to be able to understand the value of your information and study based on the abstract alone. Okay, so we talked about objectives already. Here's a few good examples to report the outcomes of calves with whatever disease treated with. By the way, the outcomes are for animals, not procedures. So make sure it's outcomes of animals. To determine the influence or effect of whatever intervention on whatever outcome, or to identify factors influencing whatever prognostic factor. Okay, so next in your abstract, your study design and animals. So make sure that you identify clearly what study design you are using. And I've included this slide just as a resource for you. And then the methods and the results. Obviously, you have 250 words to convey your study. So you may not be able to convey everything you want. You will have to select the information so that there is an alignment between your objectives, your methods, your results, and your conclusions. So you want to disclose the methods that are used to test, that are essential to testing the objectives, and the results. You want to, again, include the essential results. So your goal is that the reader should be able to understand how you generated your study and the adequacy of your methods, and feel convinced that your conclusions is supported by the results and address the objectives. Okay, so just a tip: use ratio rather than percentages, or in addition to percentages if your sample size is low, or if the population tested varies between the different results that you have. So for example, if you lost cases to follow up for some of the measures of outcome, we need to have the total N value that was available. Okay, conclusion. Your conclusion is strictly derived from your results. It needs to address the objectives, and it's typically written in past tense because it refers to your study. Whereas the impact and the clinical relevance is your opportunity to broaden the scope and show the impact of your study. And that's usually written in present tense. Okay, so the introduction, and again, some of this information is also in our instructions, so hopefully you can use that as a reminder as well. You're going to start by your general issue, and I think usually people are pretty good about doing that, presenting the importance, preferably with objective data. Then you talk about the current approach. How is the condition treated currently? You're going to move from the traditional to the most state-of-the-art. It's also an opportunity, if your team has previous work in that area, to mention it here. And then you end your introduction with your limitations and your gap in knowledge. Do not forget to state why the gap in knowledge is important. So, so for example, you could say the dynamic imbalance associated with cranial cruciate ligament disease has not been fully established, which prevent the development of preventive measures, for example. Okay, so again, you can raise the impact here, and when you state the general issue as well as in the gap in knowledge. And in the middle, that just shows that you know what you're talking about when you do your current approach. Okay, so then once you have your limitation and your gap in knowledge, as well as stated its importance, you can introduce the rationale for your study and your approach. That's also called your justification. And just because something has not been done in the past is not in itself a justification. So make sure that you clarify why your study is important. For example, if you say, oh, well, the current limitation with this approach is that whatever, the death rate is so high, then you will need to provide a rationale as to why you think your approach would decrease the death rate, if that makes sense. Okay, and then that's when you finish your paragraph with the objectives, which must match the objectives, and sorry, they must match your gap in knowledge. Okay, so you do have, that is essential. This slide is essential in your organization of your article. We already talked about the organization of the introduction. That's the first line. By the way, your objective should reflect your title, or your title should be aligned with the objectives. So try to write a title that is, again, reflecting why you did the study rather than how, and make sure it's aligned with your objectives. And your hypothesis then dictate your study design. That's in the ideal case scenario with an intentional study. And then you have results that leads to valid conclusion addressing the gap in knowledge. If you did a convenient study, this is fine, but you still need to create that flow. So you're going to have to perhaps work reverse, but maintain that flow. Okay, so where do you show the impact? You've got plenty of opportunity in the abstract, the introduction, and the end of the discussion. Okay, when you write your paper, make sure you aim for clarity, a logical flow, and a precise and concise style. And again, that in itself could be, an entire workshop, the scientific writing. So if you've never done scientific writing, this is your first time getting into it, there are a few self-help tools. Make sure you use the words functions. Those are free. You need to check your manuscript for spelling, and then at the end you will have readability statistics, and you are aiming ideally for a grade level that is around 14, so something fairly easy to read. Short sentences, 22, 27 words per sentence. Direct style, start with the subject, not the subordinate clause, so put what's important at the beginning of the sentence. Be very concise. And I do realize that it can be tricky if this is the first time you're doing it, which is why you want to have your senior co-authors help you out with that. You can also use Grammarly, by the way. That's a free software for grammar to help you out, especially with punctuation, things like that. But again, the senior co-authors are essential. And, I should remind you that it is a requirement for each co-author to provide a critical review of your article. So they really need to do that to be listed as authors. And they provide a unique help because not only do they have a track record of writing, so they have the scientific writing style, but they also know your field. So they can also provide scientific editing, which a professional editing service will not be able to do. That's why my advice is to start, with your senior co-authors. If during the process, if we find that there are deficiency, we may advise you to take a professional editing services. Those cost a few $100s, but they will clean up your formatting, your grammar, typos, things like that. Again, they will not do scientific editing. So you do need to have the scientific flow to start with. Okay, before you submit, you're going to proofread. Again, I've given you some self-help, so make sure you use those tools. Have your co-authors proofread. Again, this is a requirement for co-authorship. Keep their critical review, a copy of their critical review for your records, and then have your friends proofread. Okay, so in conclusion, we're gonna wrap this up. That I promised 5 critical concepts to transform an idea into a publication. It's also what I call the ifs and Fs of publication. So let's get on with it. Number 1, I is for impact. So aim for impact when you design your study. Show the impact when you write the article. Convince the reviewers that your paper must be published. 2, F for feasibility. Take feasibility into consideration when you design your study, especially if you are working on a very short timeline. 3, E is for ethics. Check the ethics before you start your research, especially if you are going to have some animal use, even cadavers, or some human subjects, even on a survey. Check those boxes before you get started. F is for flow. If there is anything you need to remember from these slides in terms of, from this presentation in terms of organizing your paper, this is it. Make sure you have that flow in your paper. Maybe your study was intentional, in which case the flow should come pretty easily. But if it was convenience, if it was a convenient study, that's okay too. You just need to make sure that you follow the flow and again, convince the reviewers of the value of your study and findings. And finally, S is for style or scientific writing. Readability goes a long way to make sure that the reviewers can read your paper and understand your information and look favorably on your study. Remember that research is all about attention to detail, and having proper grammar, proper formatting is part of attention to detail. So this is just that little extra that can put a positive light on your work. And with that, I thank you for your attention. I'll be happy to entertain any questions we may have. I believe we have a couple of minutes.
Thank you, Dr. Graban. That was a very good presentation in terms of what we should do to help get our papers published as quickly as we possibly can. I had one question for you. I was wondering, what do you see as the biggest pitfall when you see papers coming to you and crossing your desk? How can we get into that pile that goes on to see the reviewers?
So honestly, a lot of the paper that I triaged or submitted from non-diplomates that come from other parts of the world. And typically there are several issues such as animal management, animal welfare questions that does not meet our standards, a science that is seems suboptimal, and major formatting and writing errors. In terms of among the residents and diplomats population, probably the most common, well, it's a mix, those are not reject, they're just unsubmitting. That means I unsubmit the manuscript so they can fix it before it goes to the reviewers. So it's not a rejection, it just delays the process. Probably the most common is animal use, not disclosing where the cadavers are coming from. That's a common oversight. The second one would be large authorship. We are seeing more and more papers that have 10 authors. And so these ones I try to understand a little bit better who did what. And sometimes I have to ask for clarification. And then the third one, but much less common, would be self-plagiarism. And those are usually, seasoned authors that have written over and over about their topic, and there is overlap between their papers. Like I said, there's so many ways you can state the importance of cranial cruciate ligament disease. So it's not malicious, it's just, not being aware of that. And usually on these ones, I just have them edit the paper to limit the overlap. And sometimes I have to, there's been I would say a handful where I have to seek clarification as to why the paper is not a duplicate paper. So that's what I mean when you submit, pay attention to that question about the overlap with either current or past studies.
We did have one more question in the chat. How do you suggest approaching a scenario when reviewers are contradicting each other?
So yes, I've had that too. Believe it or not, I'm also an author, so I do get the same frustration as you guys get. Honestly, as an editor-in-chief, I would like the associate editor to provide clarity and guidance as to what they see fit. To me, this is the role of the associate editor to oversee the review process and clarify when there is divergence between reviewers. If this is not clear, I will tend to go by seniority. So if the editor-in-chief has a recommendation that perhaps contradicts one of the reviewer, I'm going to go with the editor-in-chief. Same with the associate editor. So if the associate editor makes a statement about one way or the other, I will follow that. If you have two reviewers that are equally divergent, then I would use my own judgment and select the option that seems most correct to me, and explain that. So hopefully it needs to be one of the two, right? Don't offer a third one, but one of the two. And in your response, explain, yes, we agree with reviewer 1, and therefore we have made these changes. And then for reviewer 2, you would say, you know, we do not feel that this would be the best way to go because blah, blah, blah. And instead, we are following the recommendation from the other reviewer. So make that clear in both areas, just in case the reviewer tend to just look at their portion of the response, so that they know that the other reviewer disagreed with them and you agree with the other reviewer. Use facts. Do not make it personal. I know we all get irritated when we get a review and that is, you know, perceived as a little offensive, or that we feel should have been understood a different way. Take a deep breath. Do not respond right away. Take a few days to digest, ruminate the review in your head about how you are going to best address it. Think of it as a debate. It is not a personal attack. They don't know you. There may be some differences of opinions, and that's, you know, that's not uncommon among surgeons, but please distance yourself from the process. Do not start making assumptions about the reviewers or vice versa. Just be very down to earth. And if you feel that the reviewer, you know, do you disagree with the recommendation, do so in a, you know, provide the facts and the evidence is what I would suggest.
Makes sense. We did have one more question, and their question involves small retrospective studies. And so if a person in that group submits a number of cases, say 3 to 4, but only one of those cases qualifies based on their inclusion/exclusion criteria, can you still have that person on the manuscript to edit and receive authorship? So if they submitted cases, they engaged in the process, but most of their cases were thrown out, are they still an author?
So again, it's not just because you provide a case that is enough to be to gain co-authorship. It's about the intellectual contribution. So to become a co-author, you have to be involved in the process of reviewing the analysis, either through at least the critical review of the draft. So it is not there's no prescriptive information about how much of the data you need to collect to justify being part of a study. I think this is something you need to work out with your collaborators when you start. But for example, if you have you know, a biomechanical study as part of your study, and that person will only be analyzing 5 specimens, whereas you have an in vitro portion with cell culture and whatnot, well, that may still be, and that probably still is, a good scientific contribution, as long as that person remains engaged until the paper is finalized. So I think what the participant is asking is more, should they still be involved in the study if they can only provide one case? And honestly, this is up to your collaborators. So this is something to discuss with the collaborators. I can tell you, I had myself a multi-institutional study. I can't remember. I think we had over 100 cases, and I had someone who only gave 2 cases, and that person, that was an acknowledgement, not an authorship. I had other authors who provided 50 cases, and those authors, you know, kept involved in the study. This is really up to your collaborators and how they set it up from the beginning.
That makes sense. I'm going to wait one more minute to see if anyone else has a question that they're rapidly trying to type. I'll give you guys one more chance. All right, I think that's all the questions for tonight.